This meeting is now being recorded.
I may not cover all the slides, but they're always available here, and there's much more information available on my website and also in my book. So how does my practice work? I've always believed in giving community psychology away. Newsletters and tip sheets, publications in the journals that the people I'm trying to reach read, like the Municipal Advocate, which is a magazine in Massachusetts that goes to mayors and people who work in cities, the National Civic Review, Perspectives on Aging, and various newsletters. I do publish in community psychology journals, but it doesn't achieve the exact same thing for me. My audience is those people working in the communities, in the health and human service system, in the community development system, and the grassroots groups themselves. And therefore, people come to me for help with coalitions, and they come in various ways. In the earlier years, they used to come to me through word of mouth, or they'd seen something I'd put out there, a tip sheet. Now most of them come to me through the web and through my website. And so it's a very different way of getting the word out. So who are the people who come? What do they want? Let me run through a range of examples so you get some feel for this, and then we'll go right into the training. The Boston Public Health Commission Center for Health Equity and Social Justice actually called Bill Berkowitz and said, we need someone who can do some training on sustainability. And Bill sent them to me, and I worked with one coalition that was coming to the end of their grant and talked about sustainability, and that was an opening to work with them for 5 years as they struggled with issues of health disparities and racial justice, and expanded to working in 13 different communities. So that became long-standing. I worked with the U.S. breastfeeding coalitions maybe 5-6 years ago when they were just thinking about starting coalitions, and I gave them the basics and urged them to move forward, and they invited me back now 5 years later this past summer, and they have a coalition in every state. Very impressive. And we now are looking at how do you do community engagement, because they did not have the people most affected by the issue in the room. I got an interesting call from the IRS about 3 or 4 years ago, because they have a program called VITA that you may know, which is volunteers and tax assistance, where they use college students and others to do tax forms for low-income people, which requires building a huge network of links, and the IRS is not always terrific at that, so I helped them with that. In a similar way, the Center for Medicaid and Medicare Studies found me because they have end-stage renal disease, dialysis units, that don't have much connection to other, actually it's the quality assurance looking at those dialysis units. They don't have much connection to other people. They work in their own silos. And after Katrina, the hurricane, when they wiped out the power for all these dialysis units, the quality assurance people realized, oh my God, we better be tied to the people who do disaster planning. So I will speak up. So I started working with them. So that gives you a feel. In Texas, the CDC sent some people to me who were starting domestic violence coalitions. So I came down there just for a startup, and they took it from there. And 2 new ones that came to me on the web just show the power of the web. There's the Coalition to Prevent ADHD Medication Misuse on Campus, which has got the American Association of Family Physicians and the National Association of Student Personnel folks, and is funded by Shire Pharmaceuticals, and have been helping them put a coalition together. And I just came back 2 weeks ago from a gig being the keynote speaker at King Fahd University for Petroleum and Minerals, where they're starting to build a nonprofit sector in Saudi Arabia. And there I was. So it's quite interesting, the range of people who are struggling with this issue. And I think it's true for a lot of what we do in community psychology. There are a lot of people who can use our services. And I have been really blessed to be able to do this work with these various people. What I see is a hugely dysfunctional helping system and dysfunctional coalitions. And so what I try to do is get people to look at that and become more effective. So here's what we're going to do. We're going to go through a typical training. And where I start with the training is what I call stand and declare. And I usually have people go to 5 spaces around the room and dealing with strongly agree, neutral disagree, strongly disagree in relationship to the statement I put up front. Then they talk with each other, and then they report out. And the main reason I do this to start a workshop is to get everybody talking so they don't think this is going to be someplace where I just lecture them. So we're going to do the same thing here. We're going to put up a poll and ask you, in collaboration with representatives from all parts of the community, is fun and easy? Is that something you strongly agree with, agree, neutral, disagree, strongly disagree? The poll will go up. You'll be able to vote, and we'll be able to see it. Okay? I can't see the voting. Is it up there for people?
It is up there, yes.
Okay. Can you make it so I can see it?
Well, I demoted you like we planned, and if you're not seeing it, I don't know why not, unfortunately. Okay. But I will talk us through it. So we've got 30 of the 41 responses so far, and so we'll just give a few more seconds. Some of the folks are on the phone, and they may not therefore be able to vote, but we'll give folks a few more seconds before we close. Right now, the leading answer here, Tom, is that 37% of the participants say that they agree with the statement, and 53% disagree.
Okay.
Got a small minority who fall kind of in the in-between parts of the scale.
Great. And that gets, the discussion started, because we would ordinarily have the people who disagree say why, and the people who agree say why. And you see the full range of experience and feelings about this work, which is important in the beginning, because people come to a workshop like this with a lot of feelings. And strongly, they've been in a lot of bad coalitions. So, in collaborations where we share information, these exchanges lead to community changes in programs, policies, and practices. Get the poll up.
All right, here we go. So far, folks are voting. I'm assuming you still can't see it for some reason, Tom. No. I apologize, okay. But right now we're getting a primary answer for folks about just shy of 60% who say they agree.
Strongly agree.
Just agree. Strongly agree is only getting about 3.5% here.
Right.
And then we kind of have a split between neutral and disagree, about 23% for neutral, 20% for disagree.
Okay. And what I'm trying to get at with this one, and again, we'll do the discussion, is for people, a lot of coalitions stop at exchanging information and don't go any further. And I'll give them some more options in a minute. And I'm just wanting people to look at this and realize that it's got to go beyond that. Let's do one more. In collaborations where we, in collaborative efforts in our community, we always engage. Can we go to the next one?
I think we haven't used this one yet. In collaborative efforts in our community, we always engage those most affected by the problem as equal partners at the table. And they willingly join us and participate actively.
Oh, I got it. Okay, got it. I have to go. Right. And this is the critical one. This is the most important of the three, because what is happening in coalitions nowadays, and it's increasing, is that the people most affected by the issue are not at the table. And it used to be that people, when I did this exercise, and I've done it for 10, 15 years, would say, yeah, we have them at the table, and we really want to work harder at it. And now they're more likely to say, we don't have them at the table, and it's really impossible to get them there. And I think the disconnect between our helping systems and the people they are supposed to be serving is scary. And so this gets that on the table right away. I shut up. I don't give many of my views. But you can see these are written to be provocative, and they're also written to get a spread of votes. What do we get here on votes?
Well, most people seem like they have had a similar experience to you, Tom. We've got about 48% saying that, or 50% saying that they disagree, with 25% saying they strongly disagree. So 75% of the respondents have had a similar experience to you. And then 15% neutral. We have no one who strongly agrees that those impacted are brought to the table.
And in a typical workshop, I'll have some people, because they will have had the experience of doing that, because there are always a couple who successfully manage it. And I think this, you'll see later on, I spend a lot of time on how do you get the community, the grassroots community, to the table, because the answer to this thing usually scares me. Okay, let's keep going. So now I'm going to go back through some of the content. Defining collaborative solutions very simply as doing together that which we cannot do alone, because that's what this is all about. And it acknowledges that we can't do anything alone, which is not the usual way the nonprofit sector thinks. My agency can do it all. And then Steve Fawcett and company gave us the definition below it, which is it's organizations with a common interest who work together for a common goal. We often have people together with a common interest at the table, but they may not have a common goal. The mayor says, I want all the youth-serving agencies to meet. I'm tired of the fact that you're always bickering with each other. So they do. They meet every month, Thursday afternoon at 4 o'clock, and their only common goal is to make sure that they calm down the mayor, but they have no interest in really problem-solving how to make services for adolescents any better. And so you have to not only have the common interest, but you have to help people find a common goal, which is not obvious because they call themselves the after-school programs, and everybody in the city who does that is in the same room, and you would think they actually have a common goal. And so why do people do collaborative solutions and coalitions? For the range of reasons down here: to create social change, social innovation, expand interventions. Sometimes, not so positively, they're doing it because government says we want you to do more with less, and so we're budget cuts, and we'll say we'll solve it by having a coalition. And, you know, for me, the real importance has been to build healthy communities. And so that's part of what we are doing here. And again, I'm trying to give people definitions that allow them to find their work in it. More definitions this time coming from the work of David Crislip and company, who does some really good work on collaborative leadership. The purpose of collaboration is to address something that goes beyond the purview of any particular party. And I think that's very hard for the parties in the institutions in the community to understand, that they aren't doing this whole thing by themselves. Well, we are the Sexual Assault Crisis Center, so we handle this. Well, what about everybody else in the community who's part of dealing with this, the emergency room and the police and the women's groups and the salons and everybody else? And so they have to understand there are more people who are there. And that this doesn't happen without sharing responsibility, authority, and accountability for achieving results. So remember, a coalition is a group of independent organizations who come together to do this work together, and they're usually only accountable to their funders and to their boards and their directors. Now they have to find a way to be, accountable to each other and around sharing responsibility and authority and accountability. And so in order for a coalition to succeed, it has to agree upon the problem and agree upon the vision. They have to have some way of doing this. And they have to have a strategy, and they have to have action steps they agree on. And you would think, well, here, yeah, we are a coalition. Of course we must have this. But if you look closely, a very large number of them were set up by foundations of federal government or state government and told what it is they're supposed to do. And so they really haven't internally developed the problem and the vision. Sometimes the problem and the vision are handed to them. We're looking for coalitions to address the substance abuse problem using this outcome. And they've never been able to ask around their community what their vision would be. So I want to put this forth to them to start thinking about at the beginning. So this is more just giving them information and trying to give them examples of this as I go. Here I go into more detail. This is the concerns with the Health and Human Service system. And I'm very concerned about how dysfunctional the system is, and we need to acknowledge that. If everybody, and especially when you're working with government agencies, thinks we're doing everything hunky-dory, we got a problem. But fragmentation is one problem. Everybody in the neighborhood knows that the Jones family is a violent family. The fact that mom and dad hit each other goes to the domestic violence people. The fact that mom's a little rough with the kids goes to the child abuse people. The fact that their teenage son is, maybe getting into a gang goes to youth services people. Those three agencies don't talk to each other, and they don't know what everybody else in the community knows, which is this is a violent family. So our fragmentation really is a problem in our helping system. We duplicate efforts. In a community, and this is just not services, but we can have a small community of 5,000 where there are 3 different efforts on teen pregnancy prevention. One in the schools, one in the public health department, and one in family planning. And neither of them, not only do they not work with each other, they often don't even know the other one exists. So the dysfunctions in our helping system, part of what we do with coalition building is try to overcome that. We focus on the deficits, and I'll talk about that more in a minute. The crisis orientation, and we in community psychology know this really well in terms of the importance of looking at prevention. The systems fail to respond to the diversity in the community. We really only deal with a subset of the people we've dealt with forever, and the fact that the demographics of the community has changed doesn't mean that we now offer our services in Spanish. We just keep doing the same old thing. We excessively rely on professionalism, and this usually puts everybody in the room uptight when I say this. But I always say to them, if you go into the community, and I hope you've all had this experience, if not, try it, and ask people in the community, where do people turn to for help on your issue, whatever the issue is, aging parents, difficult newborns, difficult teenagers. What do people answer you? And they all answer the same thing. They say family, friends, and neighbors. That's the knowledge we have. That's the knowledge we have in community psychology. But we act in the professional system, in the helping system, as if people immediately go running to my agency because I'm called the Domestic Violence Agency. Wouldn't they come to me first? But they don't. They actually will go to the family, friends, and neighbors. They'll go to the salon. So if you want to let people know about your services, I always say, don't send it to me, Tom Wolff, psychologist, number 187 on the list of people who are going to be turned to, but get it on a magnet and put it on the refrigerator so the family, friends, and neighbors know about it. The system is increasingly detached from the community and clients. Our whole helping system is based on competition. I always ask, if you're in a community with 2 hospitals, what's their relationship? And everybody says competitive, but if I push them a little bit, in fact, it is that one hospital is trying to put the other hospital out of business. And I can say to them, and I'm in a small community I'm in where there are 2 4-person staffed Latino organizations, they're doing the same thing, trying to put each other out of business. This is not helpful. With limited and inaccessible information for line staff, we've lost our spiritual purpose. People who go into this business don't go into it for the terrific, a golden parachute that comes at the end of working for 20 years for the Department of Social Services. They go into it because they want to help. They have a larger purpose in mind, and we never call upon that. And then we fail to engage those most directly affected. So you can see I'm taking that message and banging them over the head because I want them to really think about changing that. So we then start with the next exercise, and we can all participate in this a little bit, which is what I'm trying to get from them is what is their knowledge, what's their wisdom about what works and what doesn't, before I share with them what the research says works and doesn't. And I do this very importantly early on because what I want to make clear is that some coalitions work and some don't. And it's really important to note this early because otherwise someone's going to raise their hand and say, Tom, you're saying this about the coalitions I've been in, they've all been dysfunctional. What do you say about that? And so I want to say right from the beginning, no kidding. We acknowledge that there are ones that work and don't, so share some of it. So think for a moment about a good coalition you've coached, you've been a part of, you've seen in action. What is it that they did, and why were they successful? And then we'll ask the same thing about the negative experiences. And we have a way of posting this, right?
That's right. You guys I just put a sample of how you could indicate whether you felt it was positive and then could maybe just use a few words to describe it, or negative and then use a few words to describe it, so we can all look at the public chat box and see what some of the experiences are that you've had.
And I'm going to have to do this without seeing it, huh?
Well, you should be able to see it, Tom. You're not seeing anything?
Nothing. I see the same slide I had on.
But in the public chat box down to the left.
Okay, I see your comment, but...
Okay, so far we don't have anyone weighing in. Oh, thanks, Nicole. Nicole was pointing out that perhaps if you've selected full screen in the upper right corner, you may not see the public chat box.
No, I see the public chat box. Thank you.
Oh, okay.
No. So we're not giving a voting poll here. They're just going to write in the chat box.
So Carlos Luis
Yes.
put in that he's had a positive experience of groups and individuals sharing a common goal and purpose.
Yeah,
and
I
Carlos,
can see that.
what kind of problem were you guys focusing on, or what were the stakeholder groups that were being brought together? maybe Carlos Luis will join in. We have a negative experience coming in from Nev. She describes coalition leaders all competing for the same money, kind of like you were describing, Tom, more interested in advancing their personal career or getting money versus sharing common goals.
Right, right. And the question is, in both those, why did the positive one work? Why were they able to share a common goal? And why was no one able to manage the resources? There's positive experience with Suzanne is believing that we can accomplish something, and that's really critical. A lot of people in the Health and Human Service system are quite despondent and not feeling like there's much hope, and so really important to be able to see that you can move forward. Okay, you're getting it. This is terrific. You're putting down all the issues, and so you can imagine this allows people to express the positive and the negative and talk about, this coalition was great because we had a really good leader. This one was terrible because we never started the meetings on time, and you start to get, and the importance of that is I can say to them, you see, you have a lot of experience. And if that's the case, and they all told me in some detail about how bad the negative experiences are, I got to say to them, why do you sit in the midst of these if you know they're not working? So they then show them, this came from the Reeses and Fawcett summary of what works in coalitions from quite a way back, and Beth Rosenthal's work on substance abuse coalitions, that this is what the literature shows. Having a clear vision and mission. And they will have told me in the earlier exercise that these coalitions didn't have a vision. Action planning for community and systems change. They'll have told me that all they did was talk, and they never came up with an action plan. Develop and support leadership. They'll have told me that they didn't have a leader, or the leader wasn't very strong. Just let them go on and on and on. Documentation, ongoing feedback. Very few of them are actually measuring things and checking their progress in any kind of way without even talking about data. They're not getting help and support when they need it. Securing the resources they need for their work, that usually is a critical issue. But most important, I say to them, at the bottom is that outcomes matter. As Nev pointed out early on, so many of them are just there for their own self-interest. And whether they improve the lives of adolescents or African-American youth or whatever the target of the population is, may be secondary to them. And then the other research that Rosenthal found in working with those coalitions, looking at the data on substance abuse coalitions, was that those coalitions that labeled conflict, they didn't have to solve it, they just had to label it, had much better outcomes in terms of substance abuse prevention than the ones that didn't. So again, this is looking at coalitions that created community change and what were the variables. And it's so interesting because I've worked with a lot of coalitions, like in Minnesota, northern Minnesota. They said to me when we talked about conflict, they said, well, we're known to be Minnesota nice, so we don't like conflict. And we're not saying that you have to resolve it, but you have to at least acknowledge that conflict exists and to be able to move on. And a lot of times, Health and Human Services, that's not the norm. Again, I'm moving through this quickly to get you some idea about what this is about and what I try to share. So now we go to collaborative solutions, which is the title of the book, and these are the 6 core principles from the book. And each focuses on a deficit in the system. First, engage a broad spectrum of the community, and we've already beaten that to death. But I talk about celebrate racial and cultural diversity as opposed to, we have to become more sensitive. The richness of our communities is the diversity, and we have to move to an asset view of that. A second is to encourage true collaboration, and this is very important and has a worksheet. This is the work of Arthur Himmelman, because he's defined what happens in a coalition. And I ask people to look at this and say, what are you doing in yours? And each one of these 4 phases, networking, coordination, cooperation, collaboration, is more complex, is more risky, and is more powerful. So we start with networking, exchanging information, absolutely core building block, but not something that creates all the change. And I ask them, how do you do that in your coalitions? And they all indicate, well, we do this at the beginning of the meeting, we go around. Coordination is exchanging information and modifying activities. Now we're going to do something about that information we exchange. So in one community, small rural community of 6,000, we were looking at how the homeless people would get a hot meal. And someone said to us, the churches do it. So we went to the Interfaith Council, and we said to them, well, we understand you serve hot meals. And they said, oh, yeah, two of the churches said, yeah, we do. And we said, well, when do you do that? And the first one said, oh, we do on Sunday when we have our parishioners there. Now the other church looked very sheepish because they said, oh, we do on Sunday too. I didn't know you did that. Small town, only a few churches. They didn't know it. But because there were churches, one of them said, okay, we'll move to Wednesday. If they were hospitals, they would say, okay, I'll advertise mine better so I get the homeless people to my place. But in this case, it went on further. Cooperation is now building on this, and now we're talking about sharing resources. And that makes everybody anxious. Everybody grabs their wallet and said, do you mean my resources? For a common purpose, which also means you have to have a common purpose. You have to have done a visioning exercise and endorsed the direction you're going in. You'd be surprised how many coalitions you're in, you see, that haven't done it. They've been set up because 10 years ago someone set up a teen pregnancy coalition, and we've been in it ever since. And the people who were in weren't there in the beginning, and they don't have a common purpose, but they come because their agency says we need to be there. And so that's another piece. And the sharing resources could be as simple as the Cambodian community is having a fair next Saturday, and they're renting a table for $75. Can three of us share a table and put our material on? Yeah, that's sharing resources. That's $25 a piece. But in Springfield, Massachusetts, they wanted to go door to door, knocking on doors in the Hispanic community. And there were 3 agencies with preventive programs, one on HIV, one on teen pregnancy, one on substance abuse. And all of them had a little bit of outreach money, but not enough to start knocking on doors. So they pooled the money, and they got the Department of Public Health to give it all to one agency, who then went forward with their outreach worker who carried all 3 messages. And if I was one of the agencies, I had to trust that your person who was going to knock on doors was going to carry my HIV message, which came with my grant, in that process. So there's a lot of trust involved, but I always use that example because it says if we hadn't shared resources, not a single door would be knocked on. And that's the case in many, many communities who say, oh, we don't have the money for this, we don't have the money for that. If they looked around in their own budgets, they'd find they do if they were willing to share and give up some territory. This is a very critical one. You can see these are getting more complex, more powerful, and sometimes harder to accomplish. And finally, collaboration, which is the word we use all the time, Himmelman says it's enhancing the capacity of another for mutual benefit and to achieve a common goal by sharing risks, resources, rewards, and responsibilities. And so this is really what it's about. If we could actually do that, if a neighborhood association didn't just take charity from the local hospital, but actually was there trying to make the local hospital be the best it could be for their Hispanic community, and if the hospital was trying to make the neighborhood association the best it could be, our communities, our cities, and our helping systems would be very functional. So very important for them to look at this. And then I move from that to a worksheet. And I would just ask you, I don't know how we were going to do the poll on this, but which of those, when you've been in coalitions, which of the tools that Himmelman describes, networking, coordination, cooperation, collaboration, are used most frequently? And let me just make a note that in the 2000 or 2001 special issue of AJCP, where we had a whole issue on coalitions, Arthur Himmelman wrote a piece about this.
I know you may not be able to see it given what you said before, but their votes are coming in. We asked it in the form of which of the following do you use most frequently, just so we could see which on the Himmelman perspective most are using. Right now the votes indicate that there's actually kind of a dead heat. I don't know if others are seeing this. We're starting to get a little bit of nope, every time that someone else votes, it kind of evens back out a little bit. We've got about 28, 29% on the coordination, cooperation, collaboration. Networking is the lowest at about 16%.
Wow.
But we've got folks pretty evenly split between the other three.
Community psychologists are so good. I never get that. But what I do with this is to ask people, because most people are caught in coalitions that are just networking, and I ask them to take this instrument back to their coalitions and say, where are we now? Put an X, and where would we like to be? And they can get a discussion back with this coalition that just thinks that sharing information is hunky-dory to move it along. So these tools are all aimed for them to take it back to their communities and get them to move. Now let me just say, all the tools that are shared here, it reminds me of the old Jerry Rubin book, a book called Steal This Book. These are for you to use. And many of them were things I borrowed from other people. Those of us in the practice world and consulting and training, we borrow from each other, and for the first 10 years, I always make sure to say who I borrowed it from. By then, it's been so modified by me, it doesn't look like theirs anymore, and I may not keep mentioning it, but a lot of this stuff comes from other people. The third is to practice democracy, where you're really engaging everybody in the process, not top-down, and that was an interesting slide to present in Saudi Arabia, as you can imagine. And the fourth is to look at the issue of ecological approach, which of us in community psychology is natural, but in most of the communities we're looking at the individual and ignoring the setting. But here I also want to emphasize the work of John McKnight. And if you don't know his work, go find it. An article called Do No Harm. He has the best critic of the Health and Human Service system. He says, we are just caught in looking at deficits, and we need to be moving out of that, and we need to look at the assets. And he said, this is the way we usually think of things. We write our need assessments in the grants to say, look how terrible our community is, and we never look at the strengths. And here are the strengths. And so with that, I urge them to think about how they do community assessments. Traditionally, a needs assessment is, what are your needs, and how can we, the providers, meet those needs? It's very self-serving. And here you want to always ask, what are the community's strengths? And you'd be surprised how seldom people have ever asked the people in the community what the strengths of the community are, and how can you contribute to helping us find a solution. If they ask these four questions, it shifts the whole the whole paradigm, because we're now saying that the community is not a client, but is an asset and is an ally have we lost the audio? Are we okay? Okay. It's an ally in moving forward. Okay? So, whoops. The fifth is to take action. We can't just talk. We have to take action. We have to address issues of social change, because that's what this is all about ultimately. And we can't just be all talk and no action. And finally, we have to engage their spirituality. And by that I mean, we can't have a coalition that's trying to build a lovable community. And there was the lovable community movement in South Carolina, where in our meetings all we do is snipe at each other. So we have to look at our process to make sure it's in tune. And we have to look at spiritual principles: appreciation, acceptance, compassion, and critically, interdependence. A core Buddhist principle, but it's really true about the work in communities. Every one of us is interdependent on everyone else to find the solutions to community problems. Just a brief note about collective impact. This is a word that is going everywhere, and the federal government has absorbed it. It comes from an article by Kania and Kramer in the Stanford Social Innovation Review. 5 pages. They summarized what all the coalition building work that all of us have been doing for 30 years, and they became the darlings of the world. Everything is now collective impact. And like they said in the election many years ago, where's the beef? There's no there. It's very well written. It's a great overview, but it skips over all the critical things. Many of you are going to be asked to work within a collective impact framework. And, they didn't cite a single person. Fran Butterforth has written a 500-page book on coalition building collaboration. They didn't even cite her. So it's way too simplistic. They don't talk about engaging the community. They talk about having to have, they don't talk about how to get the indicators. They don't talk about how you get all these agencies to have mutually reinforcing activities, and they've not done coalitions. They are very good consultants. Kramer now gets $40,000 a talk, and it's done the field a great deal of damage because it makes it sound simplistic. And most damaging is they say you need to have a backbone organization that has at least $200,000 that can manage all of this. And I've worked with thousands of coalitions by now, and I would say 97% of those coalitions have $1.95 in their pocket, or under $5,000. They do not have $200,000 to coordinate all this. And so it's highly unrealistic, and I think it's smoothing over all the work that so many of us have done for years. So this is just a warning. Don't buy it. I'm going to write my next newsletter on it because no one has critiqued it yet, and it needs to be. So the next thing I get to then, but I need to say it to them because they've all heard it, and I got to put it in perspective. And I'm usually not as harsh as this, but with my colleagues I can be. We then talk about the barriers, because there are a lot of reasons why this is hard to do. And I get people to address each one and think about some of the ways they've solved it. But turf and competition, bad history, oh, Tom, we've tried coalitions in this community, it doesn't work here. Failure to act, they just talk, don't act. They don't have a common vision. And I will give them a visioning exercise as something that they can do. They fail to provide and create collaborative leadership. They're minimal organizational structure. They don't start on time. They don't end on time. They don't have an agenda. They don't take minutes into the next meeting. The costs outweigh the benefits. And this is really true. These meetings are an hour and a half, once a month. You get 20 people in the room. They each come from an hour away or half an hour away, or at least it's going to take them that long to get there. And you add up, all the time in hours, and you say, well, what are we doing? And I once did a coalition building workshop, and there was a woman doing a corporate time management workshop before me, and she talked about in corporations, they put a clock in the room, and everybody who comes into the room puts their number down, their staff number, and so you can immediately, in the computer, plug in their salary, and at the end of a half an hour, they can say, we just spent, $4,500, and what we talked about was Allison's vacation to the Caribbean, and what a good time she had. But I think people have to look at that. We have to really respect the fact that people are coming to this and use the time well. And we're not engaging self-interest, and this is a very controversial one. Everybody sort of feels that people should leave their self-interest at the door. But I always point out that Saul Alinsky says the only reason anyone's at the table is because of their self-interest. And so we need to engage it, and the whole problem of the hidden agendas is just unstated self-interests. So we'll keep moving. This is an example of a coalition in Boston that's been working on racial and ethnic approaches to community health. They moved beyond that. We're really working for the last 5 years on issues of racial justice. This was the coalition that worked on breast cancer, and the flyer that Barbara Farrar, who was the commissioner, put out said, if you're a black woman in Boston and you have breast or cervical cancer, racism is part of the issue. And that was really blunt, and it got these women to come into the room because they thought, yes, that's right. And it made the whole white establishment in Boston really uncomfortable. But we got to the people we needed to reach, and it was a very exciting experience for me. They work out of a social ecological model we're familiar with. This is a really critical framework for them, is that racism and institutional racism, not talking about individual people who are racists, in all of these systems are critical to our health outcomes. And we know that. Only 15% of our health outcomes have to do with access to health services. All the rest, this is more critical. And so if we're going to address health equity, we have to do it looking at the whole community. This is a terrific framework for community psychology, as is the next. As it relates to our health, our zip code may be more important than our genetic code. And this is Unnatural Causes, a video series. I think that would be a theme song for community psychology. And so they worked with youth, and it was a great example of that. You could have the youth do all the hard work of looking at the issues in the community, where are the institutions, what's driving people, what are the most critical issues. We took each one of those social determinants and ran it through a bucket meeting with the young people, And they identified, how does this issue work in our community? How does it impact our families? And they finally then had a retreat, and they did this wonderful way of mapping institutional racism in the community. They put Kimberly here in the middle, and they said, what institutions affect Kimberly's success in the community? And they put up the banks and the parks and the schools and the police and the stores, and then they said, which ones affect her positively? And they said, put a orange dot on it, and which ones affect her negatively, put a yellow dot on it, which ones are neutral, put a white dot on it. And when they stepped back and looked at it, they had a map of institutional racism in Jamaica Plain in Boston as seen by young people. This may not be science, but boy, did they get it. And we sometimes say, well, we can't talk about that with people. Amazing what young creative people can do. They issued a report based on it, talking about this drink, which is called a teeny, which sells in the Hispanic part of JP to the Hispanic youth, and where in the white part of the JP they sell orange juice in the corner stores. They also marched for jobs. So a great example of how to do this. Very often, if I'm working with coalitions that do not have, with people who do not have experience in coalitions, I've been asked often to do a leadership training for the Oklahoma Health Department. Some of those people do contracting. They've never been in a coalition. Then I do a simulation, so they'll have the experience of being in a coalition so they can make sense of the rest of the training. And again, here's a link to the Global Journal where Gregor Sarkeesian from Antioch did a beautiful job of writing it up with an example. Let me talk briefly about engaging the community, and I'm seeing the time go whipping by here. I try to lead them through an exercise that makes them think about how to get the community to the table. First, we look at agency-based and community-based, and I have a worksheet on this. This comes from the work of Chavez and Florin. And that, we usually are doing an agency-based approach where we define the problems. We are the central to the decision-making. We are the primary decision makers. And in the end, what happens is there's very low community buy-in. And we need community buy-in. You're not going to get a community to change the way it eats or it exercises or smokes if it comes from outside. So I'm making the argument here for a community-based approach, and I'm asking them to assess where they are now. And I ask, who might you engage, who else cares about your issue, and who's missing? And then I give an argument for why they need to have the grassroots there, because this is a group of people who will reach the hard to reach. They know the informal leaders. They're the historians. As I say to them, if I'm the white guy from the hospital who comes to the African-American neighborhood and I think, aren't I an angel to be here, they'll tell me, listen, one of you comes every fall and then you never come back. But no one at the hospital told me that history. So history is really important. So I get them to think about the informal and the formal sector of the community. It's a fairly arbitrary distinction, but the major institutions are the formal, and the residents themselves, organizations that are linked to the residents themselves, like neighborhood associations and PTOs, are the informal. And in coalitions, quite uniformly, they have the formal sector and they don't have the informal sector. So I have them think about the formal sector, who they have and who they're missing, and make a list on the side about those that they're missing. And they'll be missing things like churches or government officials or the media, depending on the coalition. But they'll get the usual suspects, the schools and the police and the mayor's office. And then I have them do the same thing for the informal sector. And again, remember my definition. So if I ask you about the informal sector and coalitions you've been a part of, what kind of groups, can you put in the public chat, what kind of groups have you ever seen at the table who are informal groups connected to the community? I put up, before I said as an examples earlier, the PTO, neighborhood associations. What other groups have you seen that come to the table? Because I'm trying to get them to think about who are they going to recruit. Any thoughts? Faith-based, yep. And again, you don't get the church itself, that's a formal organization, but the women's groups who work with the church or with the mosque, they're great. Social media, right, that's new, neighborhood associations, yep, you're getting it. So I went, and after they've done that, again, they're going to talk about who they have and who they're missing. I then say, before you invite the community to the table, make a decision about what you're going to do with them. And I point out this is an old piece by Aronson on the ladder of participation. It's been updated in a couple of different ways. But generally, when we bring people to the table, we put them in the bottom here. Tokenism, decoration, manipulation. And all we want to do is say, yes, we're redesigning things for youth, and we have one youth at the table, and it's interesting because he's the only kid who's ever gone to Harvard who graduated from the high school, and he's going to tell us about why kids are dropping out of school. And the other role we often do is the assigned role or consulted and informed, these middle roles, and that's where we go to the community for the needs assessment, and once we have the needs, we say, thank you very much, we'll take it from here. I was once working with a mayor who said he wanted to get his buddy to create a youth center out of the police station. So we met. It took us 3 months to get the guy to meet with the youth, and the youth came there, and he said, what do you want out of the youth, if we have a youth center at the police station? They said, we want dances on Friday night. And he said, well, we're not going to do that. What else do you want us to do? And everybody sort of laughs when I tell them that story, but we do the same thing in a more subtle way. We don't like listening. If we go to a neighborhood and we say, we've got a teen pregnancy grant, what are your needs? And they say, we need street lights. We say to them, no, we're not doing that. And finally, the top level is all shared decision-making. So we shouldn't invite people to the table unless we're ready to share the decision-making, and we should think about that before we bring them in. A stakeholder analysis is a tool where you put the name of someone from the formal sector and the name of someone from the informal sector at the top, and then you go down and you systematically in your coalition say, what are their capacities and skills, what's their potential role, what's their self-interest, which we'll only find out by asking them, who's going to recruit them, what barriers might exist, who will approach them, and when. If we do this systematically, we're going to succeed. But generally, we just don't do that. We just moan that we don't have people who are from the African American community. We don't have a person from there. And, you know, the first question is a way of saying to people, I want you at the table more than as a token, African American or token Hispanic. I want you because you've got some skills that we need. And if we don't think about that, we won't do it right. The main reason the people volunteer is that someone asks them, and then I talk a little bit about things you're familiar with, which is ways of, reaching groups. And then there's some literature, again, available on my website. There's a lot of free material on my website about why people stay in the group, which is all the 6 R's of participation. Recognition, respect, roles, relationships, reward, and results. Residents and people from the community, more than the professionals, will only be in the room if it looks like really going to get results. So, the mother of the teenager who comes, if it looks like what you're mainly trying to do is fulfill the needs of your grant and grab some money and not make life better for her kid, she's out of there after one meeting. And people have to think about that, and Gillian Kay has done a nice exercise tool that's in that article on my webpage where you can rate your coalition as to how receptive you are around these 6 R's. So that's a piece I do on engaging the community. And you can see it's a long piece, but I think unless we have the real people most affected by the issue at the table, we're spinning wheels and wasting our time. I'll skip over the next, which is a story of a neighborhood center, so we can have a little bit of time just to talk about collaborative leadership before I open it up for a couple of questions. I need to make the point, and here we'll do one quick stand and declare. You want to put one up, Lindsay?
Sure. Do you have one in mind or just?
The first one, whatever.
Okay.
So here the stand and declare is, I know that coalition leaders should delegate as much as possible, but so often I could do the task myself in half the time it takes to delegate to another coalition member, so I just do it. Is that up?
It's up, and folks are starting to weigh in. So
again,
far, agree is in the lead.
Right.
But
again,
there's actually quite a distribution here, Tom. So it's still the case that the agree is in the lead, but we also have quite a few people saying that they disagree and even strongly disagree.
Right.
And we don't have that many people saying they strongly agree. We
so
only have
what
one.
Go ahead. I'm sorry.
I just said we only have one person who strongly agrees with that sentiment.
It is a dominant sentiment in the helping world that, although they wouldn't vote that way, but when we start talking, people really say that. And I always give the analogy of, if your adolescent son doesn't make the bed and you keep making it, how long are you going to do that? You're going to follow when they move out of the house? But they have a tendency to want to do it themselves because what they'll say to me is, well, I know it'll get done right. And delegating, it's such a risk and people mess it up. And yet, for me, collaborative leadership is all about building leaders. It's good to have a good facilitative leader, but if that facilitative leader isn't looking around at every meeting and having someone else step forth to take leadership, then we're in trouble. And the really excellent coalition leaders are the ones who do that. So and then we talk a little bit about the skills and the attributes of a successful leader. So that, I'm running, but the last issue that I always touch on and often do whole workshops on, and again, the material for that's available, is on sustainability. So much of this is, you get a grant to create a coalition for 2 or 3 years, then it's over, and they all stop, and then they start up 3 years later on another coalition. But you really need to look at sustainability is not just how do you get the money to keep this thing going, but it is what are we trying to create in the first place. And so there's a long piece in the first issue of the Global Journal with a whole tool on sustainability that gets us to look at, how do we sustain things with money, but how do we sustain things by institutionalizing them in the community? How do we sustain them by having the community come forth and own it? And how do we sustain them by changing policy? That is a fast race through the issues of coalition building as I try to present it to people in the community. And so I know that I always end with a couple of things. One is, what are you going to do different because you've been in here? And sometimes we do it with this chart. Often we just do it by going around the room and saying, name one thing you're going to do differently. And then just to calm the people down, I really say, be optimistic because it feels better, and then give them resources to turn to. And the toolbox is a great one. I have a lot of free resources on my website. The Global Journal is great. And then my book is the other. So that's a real race through this.
Thanks, Tom. I see that there's a question that's coming through from Suzanne, which is maybe a great place to jump in with the few minutes we have for questions. The question is, how do we protect time for discussion? And there's also a note about how it may vary depending on whether you're in person or whether you're trying to engage online.
How do in a webinar like this, or?
I think, Suzanne, you can correct me through the chat, but I think she's talking about specifically in this work. How do you make sure that there's enough time for discussion when working with a coalition?
That's why I say I do this sometimes, over days, over a day. Each exercise, whenever I have an exercise, I have people at the tables, at round tables, and I have each person fill out a form and answer the question first so that I know everybody on the table has an answer. And then they go around. So if we're going to do a vision, each one would do that. Then we go around and everybody shares what they had, and then the group comes up with a joint vision. Because otherwise what happens is the dominant person in the room just tells everybody what the vision is going to be, and the ones who are too shy just say, oh, okay. Or if they are residents, what happens is if we go around and introduce ourselves and those most affected by the community, person who lives in the community, I'll say I'm Tom Wolff, and they'll say I'm just Jane. And they'll introduce themselves with I'm just, I don't know, it's universal that they do it, and it's a way of saying don't listen to me. So we have to design the days and the process so that people all have a chance to talk and everybody has to be heard and listened to. And Suzanne's absolutely right. It's a huge issue in these processes. So we go very slowly. Here I was trying to give you as much as possible in a short period of time as a way that you can take it and run. But, yeah, it is an issue.
Couple more questions. One just came in from Elizabeth, and before you dive into that one, a question came through earlier that I think a lot of people mentioned. What about a situation where you're kind of forced into a coalition, or you haven't kind of begun with the community the way that we might like to, and in fact it's either a funder or some other external pressure has brought everyone together? Any specific tips at that moment to try to shift the dynamic to a more shared decision-making and shared power structure?
I think that's the norm, actually, that most of those are created that way. And one of the things I do, and it's on my website, it's in the book, is a visioning exercise, a very simple one, in which I say, a newspaper is going to do a story on your coalition. It's 2 years from now or 5 years from now. What's the headline and what are 5 bullets? And it doesn't matter what the grant said or what they all agreed to. They all start from scratch. They write up their headlines. They come up, each table comes up with a headline. Then they have, if you have 5 tables, you got 5 headlines. You come up with one joint headline. And now, as a group, you have, named where you want to go. I did this once with a statewide dental association, and where we were trying to do collaboration with all the people working on oral health. It wasn't dental, it was an oral health coalition. So I had the dentists and the hygienists and the public health people and the school people. And although they had so much discord going in, they came up with a universal goal. And then you say, okay, that's our vision. We're going to put that on the wall. Now, how do we get there? And we can do a force field analysis, SWOT analysis, use some tools to assess where we are now or where we'd like to go, and just ignore the grant and hope that when you come out with something, it is in line with the grant. But if you just go with what's been imposed on you, it's really hopeless because you only have the people with the self-interest at the table.
Thanks, Tom. There's 2 other questions that we may have time to address, and then maybe if you're willing, people can look you up on your website, tomwolff.com, and follow up with you if you have questions, or post them to the SCRA listserv if you're a member or a subscriber. But there's one set of questions that deal with how to engage with coalitions who do primarily operate online. That's kind of one part of the question. And then the question is about other resources that you may recommend online for collaborative learning or coalition building. And then there's a question from Gloria that you may see there as well about how these exercises work for stakeholders, non-professionals who are unfamiliar with them. So maybe just first, online, how do you handle these things differently online, and any resources you want to point folks toward, and then maybe Gloria's question as well.
Boy, I'm not really familiar with doing coalitions online. I haven't had that experience, I'm afraid. There's a lot of it done at a distance with webinars, and not with webinars, with phone calls and sometimes Skype. But at some point we're meeting face-to-face and we are working. I have not been involved with things that are strictly online coalitions. Is that the right question that was being asked?
I think that's fine, Tom, if that's the case. Yeah. And you've pointed folks to your website and the Global Journal of Community Practice and the Community Toolbox, which are all incredibly rich resources. Are there any other online resources that you might quickly mention that you haven't already? Someone is asking if there are other online resources for collaborative solutions and so forth.
Those are the ones I turn to. There's all kinds of other stuff. There's some really nice stuff if you're looking at doing health organizing from the county health data program out of University of Wisconsin. That's really interesting. So
Thanks.
I don't know. Let me go to Gloria's question about non-professionals. I think what we do from the beginning is try to make the residents feel a part of the community. And sometimes we can and sometimes we can't. And the experience with young people is often very interesting. The Jamaica Plain Coalition, we did have the young people in the room. And we gave them a blank piece of paper on which we wrote the word boring. And when we were going on, if they didn't feel engaged, they would flash us the sign boring, and we knew we had to change directions. You have to work overtime to keep young people in the room. We had a coalition in part of Massachusetts, one of the long-standing ones. It's now going towards its 30th year. And in the beginning, we tried to bring young people in the room, and we brought them in numbers. One of the mistakes is to bring in two young people and say, oh, you're going to represent youth. But we were bringing them in at 7 or 8 or 9 of them. And we began to realize that the way to do it was to have them create a youth coalition and then come to the bigger coalition meeting 2 or 3 times a year with their issues. And so we did that, and there's a wonderful book called Youth on Board, which talks about how adults have to modify their behavior if they're going to be in the room with youth and respect them. And so we started off the meeting by saying, the youth are going to run this meeting. You will talk when you're asked to talk. So let them, be in charge. And here we go. And so the youth took over the meeting, and about 7 minutes into it, the Girl Scout leader from the community said, when I was a teenager, And if you really want to turn youth off, there's the line. That'll just do it. So it's very hard to control adult behavior that doesn't stymie residents. And I think it's also true when you bring low-income people, people of color into coalitions that are mainly white. You know, the white privilege has to be overcome. And so it's very tricky. But you have to design and manipulate the situation consciously so that that population stays at the table. If you lose them from the table, it's tragic. So it's a great question from Gloria.
Tom, we're running out of time, and we've run over a few minutes. I just, for those who are able to stay, wouldn't mind pointing you to one last question that came in that I think is, you were alluding to there as a structural way to organize the meeting. Anna asked, how important is it how we collaborate? And they used the example, for example, nonviolent communication. And so you've talked about lots of ways to approach it in terms of structures and relationships. Any more comments about communication style?
Really important. We always start coalition. I mean, each question sets off another set of thoughts for me. Start coalitions by doing ground rules. How do we want to behave in here today? What are your rules? And so people will say one person talks at a time, you know, that whole thing. And you get everybody to contribute. And then you post that on the wall and say, these are the rules that you're going to enforce, not me. I'm the facilitator, but I'm not in charge. You are. And then at the end of the meeting, we always do plus delta. What worked at delta? What could have been different as opposed to plus minus? And it's a way to go back. So if we said at the beginning of the meeting, no one will dominate, and we've said that purposely because Dr. Jones always dominates the meeting, then at the end of the meeting we can say, well, Dr. Jones dominated again, and we have a chance to reflect on it. So it's a way of getting the coalition to process. In a wonderful HIV prevention coalition, Connect to Protect in Fenway in Boston, they have an African-American young woman suggested, and maybe one of you know the right thing for this, the three things you can do, which is you can snap your fingers if you agree. You can say, ouch, if someone said something that hurt you. And snap, ouch, and one more. But it's a good way to have not everybody have to say, oh, I agree with what Gloria said. Instead, everybody's around the room snapping their fingers, and you sort of get the sense of some rhythm building that people are in agreement on. Very nice nonverbal way, not to interrupt the flow, but for people to share ways of going. So, yeah, these are all terrific techniques. And again, a lot of that, you know, when a young woman teaches me that, I try to hang on to it because that's where a lot of this comes from. It wasn't in graduate school. In graduate school, I learned how to do psych testing and individual psychotherapy. So
Thank you so much. I really appreciate you presenting and joining us, and your expertise, Tom, and from doing this work is so invaluable to all of us. And so with that, I think I will close our session today, orienting everyone here. There's still several of you on the call to the fact that you'll get an email that evaluates the webinar today. And not only will we share that feedback with Tom, who obviously is very interested in his effectiveness in these domains, but also the webinar series has been sort of a proof of concept project for SCRA. And so those evaluations are really useful for us to present to the executive committee of the Society for Community Research and Action, the need and the demand for online learning opportunities. So please do keep an eye out for that email to help us with our planning for 2015. And then circling back to something that Alan posted when you were saying you did not have as much experience doing this kind of work online or virtually or remotely, Alan pointed out that the community practice group has a very engaged call on Fridays once a month where lots of people are bringing things to the table. That call takes place at the main SCRA conference line at 2 p.m. And so, Tom, maybe Alan's pointing out that you do have more experience with it than you think, and I'm sure you would welcome everyone to that call at 2 p.m.
Oh, we'd love to have you join us. And I'm seeing the comments, and I hope that you'll leave the comments up for a few minutes so I can read them. But wonderful to have an international group here. I don't know if my friend Ruben from Barcelona joined us. He said he was, but a shout-out to him if he's here. But Italy and Portugal and Egypt, bless you all for being a part of this. It's so exciting that we can be, you know, global.
Yes, thanks, Tom. And one last plug, therefore, please evaluate the webinar and participate. If you'd like to see more of these, your data will be really useful for showing and justifying the importance of maintaining this series. So thanks you all. I'm going to end the recording, and we will post this on the SCRA website at www.scra27.org. Thanks, Tom.
You're welcome. Thank you, Lindsay. Bye, everybody.
Bye-bye.